Self-development. Lee TV. Why is dementia so prevalent in middle age? Could dietary habits affect brain health? The video titled, Why is Dementia So Prevalent in Middle Age? Introduces the current situation of early onset dementia occurring in middle age. According to data released by the Korea Disease Control and Prevention Agency and the National Health Institute on the 13th, the incidence of middle-age dementia occurring before the age of 65 is increasing significantly. Its formal name is early onset dementia, indicating that dementia occurs early. In 2019 alone, there were 63,231 new patients. It has increased about 3.6 times over 10 years. Dementia occurring in the 40s to 60s. There's no denying that it significantly deteriorates the quality of life. Let's delve into middle-age dementia. Early onset dementia occurring before old age tends to progress more rapidly compared to senile dementia. Symptoms include cognitive impairment, memory loss, as well as language and motor disorders. Early onset dementia often has clear genetic characteristics compared to senile dementia. According to research by the National Health Institute, a new pathogenic mutation, P-ASPRD-GLI, was discovered as a genetic factor causing early onset dementia. This mutation was identified from patients who cannot understand words and cannot even remember the names of objects. Dementia comes in various types. Alzheimer's disease accounts for about 70%, followed by vascular dementia, alcoholic dementia, and others. Vascular dementia manifests as a decline in memory and cognitive function after a stroke, cerebral infarction, or cerebral hemorrhage occurs. It is a result of impaired brain function due to blockage, cerebral infarction, or rupture, cerebral hemorrhage, of brain blood vessels. Recently, strokes in the 40s to 50s have increased, leading to an increase in vascular dementia as a sequelae. Middle-aged women experience various postmenopausal symptoms, but the most dangerous is undoubtedly stroke. With the disappearance of estrogen, female hormone, that protects blood vessels in youth, the risk of cerebral infarction increases. If accompanied by conditions like hypertension and diabetes, the risk becomes even higher. In the United States, the Stroke Society issues a stroke warning for menopausal women. Failure to cope adequately can lead to middle-age dementia, vascular dementia, before the age of 65. The risk factors for stroke include hypertension, diabetes, dyslipidemia, hyperlipidemia, smoking, obesity, and family history. If hypertension, diabetes, and dyslipidemia occur simultaneously, the risk is higher. To prevent this, reduce salty and high-calorie foods and engage in physical activity. The guidelines for preventing cerebrovascular diseases by the Korea Disease Control and Prevention Agency recommend consuming sufficient legumes and whole grains. This is because they contain ingredients that reduce neutral fats, cholesterol, and lower blood pressure. Additionally, foods such as bluefish, mackerel, soy, tuna, nuts, olive oil, and sesame oil are rich in unsaturated fatty acids, which aid in blood vessel management. Foods high in potassium help excrete sodium from the body and improve the function of blood vessel tissue. Examples include bananas, sweet potatoes, milk, and tomatoes. People with poor kidney function should be cautious about potassium to prevent hyperkalemia. The increase in middle-age dementia is associated with various factors. This video emphasizes the importance of healthy dietary and lifestyle habits and underscores the need for appropriate prevention and treatment. Source: comedy.com, Kim Yong. Thanks for Whack Thing.